To examine for bicipital tendonitis, you start first by palpating the long head of the biceps. You can locate that by feeling the structure on the lateral aspect of the shoulder, and it feels like a pencil that you're rolling your finger over. And you can also, as you palpate, have the patient rotate their arm inward and outward, and that sometimes helps you locate the tendon as well. Tenderness over that tendon would suggest a possible inflammation. You also want to palpate over the coracoid process to the short head of the biceps tendon to see if there's any tenderness, comparing one side to the other. This is usually a tender area to palpate in anybody, but what you're looking for is tenderness that's increased on one side or the other. The other maneuvers that we can do to test for bicipital tendonitis is Speed's test, where you bring the arm in a slightly flexed position with the arm supinated, and then you ask the patient to push up against your hand. This way you're loading the bicipital tendon, and if it's inflamed, it will cause some discomfort. The other maneuver is Jurgensen's test. In this test, you bring the arm into a 90-degree position with the wrist fully pronated, and then you ask the patient to supinate, and you provide a resistance against that maneuver. And again, you're loading the biceps tendon, and if it's inflamed, it'll cause some discomfort.